Welcome to the webinar, What is Screening? This is one of 11 webinars developed by the National Center on Response to Intervention for the RTI Implementer webinar series. My name is Amy Peterson, and I provide technical assistance support for the center. This webinar provides an in-depth look at screening, considerations for screening tools, and considerations for implementing screening in a district or a school. If you have not already, you may want to pause the webinar and print out the accompanying handout. As I mentioned, the Center has developed a series of webinars to cover information that's important for RTI implementation. On this slide, you can see the different webinars available in the series. While you can watch the webinars in any sequence, we recommend that you first watch What is RTI to ensure that you have an understanding of how RTI is discussed in this series. Prior to watching this webinar, it's also recommended that you watch Understanding Types of Assessment within an RTI framework. Following this webinar, you can learn more about screening data and can also learn about establishing a screening process. There is also a series for progress monitoring and multi-level prevention system. The objectives for this training are to recognize the purpose and focus of screening, to use the screening tools chart to learn about screening tools, and to understand the time frame for screening. One helpful way to check your understanding throughout the webinar is to complete the accompanying vocabulary handout. The handout provides a table with a list of key terms in the left-hand column. To the right side, you can track your understanding both before and after viewing the webinar. Before viewing the webinar, you can make predictions about what you think each of the terms mean. Throughout the webinar, you can then complete the final meaning column based on the definitions provided in the webinar. You might also want to draw a picture or a sketch or provide examples in the far right column. On the slide, you can see an example for one way to do this. If you've not done so already, pause the webinar now and make predictions for the key terms of this webinar. Press play when you're ready to continue. This is the graphic used by the center to show response to intervention and the essential components. This training will focus on the essential component of screening, which you can see in the left of your screen. Without screening, it's difficult to determine who should be progress monitored or who should receive supplemental interventions or instruction. Screening is necessary for that initial decision-making piece. As you can see, database decision-making is in the center of the graphic because it's important for all three of the essential components. Without database decision-making, RTI is technically not being implemented. Throughout the series of webinars, you will see that database decision-making is embedded within the discussions of each of the essential components. This slide provides an overview of the information throughout the webinar. As you can see, the purpose of screening is to identify those students who are at risk for poor learning outcomes. Because RTI is a framework for providing services, the outcomes you're concerned about could be of just about anything. For example, academic achievement, behavior, graduation, or post-school outcomes. Sites, states, districts, or schools typically identify what outcomes students are expected to achieve and then screen to see which students are likely to achieve those outcomes. Screening can answer the following questions. Is our core curriculum and instruction effective? Which students need additional assessment and instruction? For example, if the desired outcome is graduation, a quick screen of attendance and credits, predictors of graduation, can reveal which students are likely to meet the requirements of graduation and which will need additional support. If the desired outcome is mastery of an end-of-year test, student performance measures, like curriculum-based measurement, or CBM, can reveal which students are not likely to pass the test and need additional support. The focus of screening is on all students, not just those students we may believe are at risk. Students may slip through the cracks unless there's a systematic process for screening in place. Screening is not a diagnostic assessment. It's a brief, reliable, and valid assessment to identify which students may need additional assessment, such as progress monitoring or diagnostic assessment, and which students might need additional instructional support. The tool should demonstrate diagnostic accuracy for predicting learning or behavioral outcomes. In other words, they should be able to accurately identify who could be at risk. At a minimum, screening should be administered more than once per year, such as the beginning of the year and the middle of the school year. Schools and districts that wish to use screening data to evaluate program effectiveness, establish local norms and cut scores, and to provide data to next year teachers typically choose to administer screening 3 times during the year, the fall, winter, and spring. and should select a screening tool that provides alternative forms and multiple benchmarks. The screening process is not unique to education. In fact, standardized screening processes are common in many other fields, such as cancer screenings, courtesy checks during oil changes, and vision screenings in the primary grades. In all of these cases, as well as in education, the purpose is to identify indicators that predict if more testing or further intervention is needed. The major thing for all of these is to identify and address potential problems early in order to prevent bigger problems in the future. The same principle applies in learning environments. In addition to identifying students at risk for poor learning outcomes and who need additional assessment and intervention, screening data can also help to identify whether the curriculum or instruction is effective. The focus of screening is on all students. The idea is that no student should fall through the cracks and that we can catch students who might be doing well at the beginning of the year that are struggling later by assessing multiple times during the year. Screening is a two-stage process. Universal screening, the first stage, is a brief assessment for all students conducted at the beginning of the school year, and many times in the winter and the spring as well. For students who score at or below the cut score on a universal screener, a second stage of screening is then conducted to more accurately predict what students are truly at risk for poor learning outcomes. This second stage involves additional, more in-depth testing or short-term progress monitoring to confirm a student's at-risk status. All measures for screening should be educationally valid outcomes. What is screened should be based on the needs and the goals of the school. Schools typically screen in reading, math, and behavior, but may also consider screening in other areas of need, such as language or writing. When selecting a screening tool, you must choose reliable, valid tools that demonstrate diagnostic accuracy for predicting which students will develop learning or behavioral difficulties. General outcome measures are commonly used as screeners because the goal is to predict to an outcome. You must choose age-appropriate outcome measures that capture student ability. It's important that the screener you choose has strong classification accuracy, meaning that the screening tool is able to accurately classify students into at-risk and not at-risk categories. For example, in reading, in order to have good classification accuracy, screenings target reading or reading-related skills that are pertinent to the grade and the time the screener is administered. For example, in kindergarten, relevant skills might include phonemic awareness, letter and sound knowledge, and vocabulary. In later grades, such as second and third grade, measures assess number and types of words students can read and comprehend and the fluency of those skills. We may have many screeners to assess different outcome measures. No screener can do it all. Here's an example of a screener. This copy is placed in front of the student. Students are provided standardized directions and asked to read aloud for 1 minute. To get an accurate score for CBM for reading at each screening period, students read 3 one-minute passages, and then the median or middle score is recorded. The Center has developed a screening tool chart that can be accessed through the Center's website. We will now look at the process for using the tool charts recommended in the User's Guide, which is also available on the Center's website, and review how the chart is structured to include both indicators of valid tools and efficiency factors. The tools charts include a large amount of information designed to assist you in selecting a tool that is most appropriate for use in your classroom, school, or district. The best tool is not going to be the same for every user and is not determined by any single element on the chart. Users of the chart should review all of the different elements of the chart when making the decisions. The Center recommends following 6 steps for using the tools charts. These are included in the User's Guide, and they are on the slide here. Gathering a team, determining your needs, determining your priorities, familiarizing yourself with the content and language of the chart, reviewing the data, and asking for more information. You can see more information about this in the User's Guide on the Center's website. Often decisions about appropriate screening tools will involve the input of multiple teachers and staff. When using the tools chart, a team of key constituents should review the information together. In gathering the team, you should think about the following questions. Who should be involved in selecting a screening tool? What types of expertise and what perspectives should be involved in selecting the tool? The most appropriate screening tool for you will depend on the specific needs of the school or district. In determining your needs, you can think about the following questions. For what skills do I need a screening tool? For which specific academic outcomes or measures am I interested in screening? For what grades do I need a screening tool? Will the screening tool be used with all students or a specific subgroup? If so, which subgroup? In addition to determining your needs for a screening tool, your team should also consider priorities. Although you may want a tool that meets all of these criteria, such a tool may not exist. You will need to weigh your priorities carefully when making your selection. In determining your priorities, you should think about the following questions. For example, if cost is a priority, ask, is it a tool that can be purchased for a reasonable cost? Another example would be about training. Is it a tool that offers ready access to training and technical support for staff? You can see other examples on the slide. These are 4 main areas on which a tool are evaluated: ratings of technical rigor, efficiency, implementation requirements, for example, costs, training needs, and the data submitted by the vendor, reliability data, validity data. The ratings of the technical rigor are represented with rating bubbles, similar to symbols used in consumer reports. A full bubble indicates convincing evidence, and an empty bubble indicates unconvincing evidence. There is a legend at the bottom of the tools chart that provides information on each of these. The first area that's presented is the rating of technical rigor. For each of these standards, the Technical Review Committee, a committee of experts in the field, review data submitted by developers of the tools and give a rating of convincing, partially convincing, or unconvincing, or no evidence. If using the tools chart online, you can click on the names of the standards in the column heads of the charts to view the definitions and the rubrics used by the TRC. As you can see, for technical rigor, there's 5 different pieces of information on the chart. The first, classification accuracy, indicates the extent to which a screening tool is able to accurately classify students into at-risk for poor learning outcomes and not at-risk for poor learning outcomes categories. The second, generalizability, is the extent to which results generated from one population can be applied to another population. A tool is considered more generalizable if studies have been conducted on larger, more representative samples. The third, reliability, is consistency with which a tool classifies students from one administration to the next. A tool is considered reliable if it produces the same results when administering the test under different conditions at different times or using different forms of the test. Validity, the fourth, is the extent to which a tool accurately measures the underlying constructs that it's intended to measure. The fifth, disaggregated data, is whether the data are disaggregated when they're calculated and reported separately for specific subpopulations, for example, by race, economic status, academic performance, and so on. The last 4 columns of the chart offer information about the efficiency for each screening tool. This includes the administration format, or is whether the tool is designed to be administered for an individual, a group, or both. The administration and scoring time, or how long it takes to administer and score the tool. The scoring key, if a scoring key is provided. If not, is it scored by a computer? And norms and benchmarks. Are there benchmarks or norms available for reference? The tools chart offers an implementation table for each tool. This can be accessed by clicking the name of the tool. The implementation table includes the following information: cost of tool, training required to implement the tool, level of staff expertise required to administer the tool, where to go for training and technical support, and how scores are reported. This information is provided by the vendor. The tools chart also includes detail about the actual data that were submitted to the TRC for review. This data can be viewed by clicking on any of the ratings bubbles in the cells in the chart. The center recommends that you look for tools that conduct classification studies with outcome measures and samples similar to your population and outcome of interest. By clicking on the rating bubble, you will obtain more information about which tool or tools is most appropriate for your population of students. To explain the ratings, it's recommended that you have someone on your team familiar with data. Examining these data can be useful for a number of reasons. You may see 2 or more tools that receive the same rating for a particular standard, but in these cases, how do you know which one is really best for your needs? By clicking on the rating and viewing the actual data, you have more information to help you determine which tool is most appropriate. For example, for classification accuracy, the chart includes statistics about how well a tool classifies students, as well as the outcome measures and the details about the sample that was used to generate such statistics. The detailed data can also help you determine the tools that you are appropriate for a subgroup of students. For example, your district or subgroup of interest may comprise mostly of English language learners. Therefore, you may be interested in how accurately the tool classifies students for risk categories, how reliable it is, and how valid it is for only the ELL students. By clicking on the bubble in the disaggregated data column, you will be able to see detailed data about how well the tool works among various subgroups. You may find that the tools chart does not provide you with all the information you need. For example, what if the tool in which you're interested does not have disaggregated data for a particular subgroup that is important to you? The center recommends you ask the vendor or developer. Developers who choose to submit their tools for review and publish them on the chart are interested in meeting the needs of their customers. As such, they're interested in doing more research to provide data that you need. Similarly, if the tool that you currently use or are interested in learning about is not on the chart, call the developer of the tool, let them know about the TRC review process and the tools chart, and ask them to consider submitting their tool for review. The tools chart provides publisher contact information in the pop-up found in the second column. For more information about the 6 recommended steps for using the screening tools chart and selecting a tool, check out the NCRTI User's Guide available for download on the Center's website. Along with that, there's also a glossary of terms on the Center's website that provides definitions for all of the different terms related to screening, for example. The last section is about the time frame for screening. When should screening occur, and how long does it take to screen? Many schools and districts screen at least 3 times a year in the fall, winter, and spring. This allows schools to use screening data to evaluate the effectiveness of the core curriculum and instruction across the year, to establish local norms and cut scores, and also provides data for the next year's teacher. Regardless of the number of times that screeners are used, screeners should remain consistent across school years and sites and must target skills pertinent to the grade and time the screen is administered. As mentioned earlier when we were talking about the screening tools charts, screenings can be delivered in 2 ways. They might be done individually or as a group. There might be different times allotted for those different kinds of administrations. All that information is also available, as I mentioned, on the tools chart. For example, screeners can be individually administered, which takes approximately 1 to 5 minutes, or they can be class-wide tests, which range from 2 to 60 minutes. Depending on the number of the students in the class that are being screened, it might be more time efficient to do a class-wide test, or it might be more time efficient to do an individually administered test. Thank you for taking the time to listen to What is Screening. To find more resources on the topic or view other webinars in the Implementer series, visit the Center's website, www.rti4success.org. You can also view additional information about RTI and screening on the RTI Action Network and the IDEA Partnership Network website. Their websites are listed on the screen now. Thank you.